Hi, I'm Dr. Doug Adler. I'm Associate Editor for Gastrointestinal Endoscopy. I'm also a Professor of Medicine at the University of Utah. I'm joined today by Dr. Banke Agarwal from St. Louis, who's going to be talking with us today about his paper, Risk of Pancreatic Cancer in Patients with Pancreatic Cyst. So how did this all come about? You were saying before that there was some background to the story of where the paper came from.
Well, yeah, actually, the question is all of us actually keep on doing surveillance for pancreatic cysts. And, nobody knows whether there is indeed an increased risk for pancreatic cancer in these patients. We know, like, if you see a cyst with advanced features, they have a tendency or risk of turning into cancer. But how about all the cysts which look very benign? How many of them actually turn into cancer? And what is the absolute, do they have indeed an increased risk of pancreatic cancer? So there was no data on this thing, so we actually have a database actually that we could tap into.
And it was a VA database,
VA
right?
database, and so the good thing is we have those patients which are locked in, so we can actually really answer that question using the VA database, and that's what we did.
So how was the study set up? How did you search the database? What was your time period?
The study was actually a retrospective analysis, and we have this database which starts from 1998 to 2007. So it's a long follow-up and the patients who are there, so it allows us to actually make a meaningful estimate of the long-term risk of pancreatic cancer in these patients.
And in the database, were you starting with patients who had cross-sectional imaging that showed a cyst, or were you looking at endoscopic ultrasounds too?
So these are the patients who had the cyst visualized on cross-sectional imaging, CT or MRI.
Right.
So EUS was not done to actually look for a cyst in these patients.
Got it. So one thing that's interesting is you began in 1998. So between 1998 and 2007, CT was pretty much CT, but MR really changed. Did you notice, or did you think that there were any differences in findings between 1998 and 2007 because MRI got so much better in that time?
So the MRI has improved, but one of the basic things the MRI picks up is fluid-filled structures. So that has not changed much. You can pick up much more details about it, but identifying a fluid-filled structure that is a cyst, it really doesn't make a difference at all. So all the advances in MRI, I don't think impacted that.
So what were some of the key findings in the study?
So one of the most important key finding, and I think the take-home finding in this case is, if you have a pancreatic cyst, the relative risk of pancreatic cancer compared to people who don't have cysts is almost 20-fold per year.
And because you were just using cross-sectional imaging, you can't say whether they were mucinous or serous, those cysts. Just all comers with a cyst.
Exactly. So, and we actually have presented data in a separate abstract at DW previously, and we are in the process of writing it for publication. About half of the cysts that are noted on CT MRI are actually mucinous cysts. The other half are either simple cysts, serous cyst adenomas, or pseudocysts. So if you actually take that data in the context of this present data, and we also know that the increase, like from the current state of knowledge, the higher risk of cancer is only in the patients who have mucinous cysts.
Right.
So if 50% of those patients with cysts actually have mucinous cysts, so the risk of cancer in patients with mucinous cysts effectively doubles. So instead of being 20-fold as we have observed in our study, it would be in the range of around 40-fold for the patients with mucinous cysts. It needs to be double checked in a future study, but when you put 2 and 2 together, that's what it looks like. And an absolute risk actually comes up to about 1% per year if we use that estimates.
So do you guys think that the risk comes from malignant transformation of the cyst, or do you think that just the presence of a cyst in and of itself is maybe a secondary marker for underlying pancreatic disease that may put them at risk for adenocarcinoma secondarily? Which one do you think?
I think it's a very important question. Anything I say will be conjecture and making an estimate or a rough guess word. It could be both. We definitely know that there are certain cysts which have a tendency to malignant transformation. There was another previous paper which showed that patients who have cysts can develop cysts outside of a cyst, develop cancer outside of a cyst.
That's exactly the point I was trying to get to.
So it might be both. And there is another paper which actually had looked at indirectly the question. They looked at the principle, how many of the pancreatic cancers are actually mucinous adenocarcinomas, because those are the ones which tend to arise from the
Those
cyst.
are the most worrisome
And
ones.
exactly, and so they also actually came up with it might be that the cysts have a tendency to convert in cancer, but it also cysts, the patients who have cysts also have a tendency to develop other adenocarcinomas.
Right.
Again, I can only just make a guess. I'm not sure I can answer that one.
So there were some recent guidelines that suggested maybe these pancreatic cysts need to be followed less stringently, with perhaps less invasive or high resolution imaging. What do you guys think about that in the context of your data?
Again, I still have to come to grips with the guidelines that the AGA proposed. For me, what we are seeing is at least 0.5 to 1% risk of cancer in these patients per year, which is a high enough risk for us to actually evaluate the pancreas. And if you look at patients who have a colonoscopy or colon cancer screening, less than 1% of those
Right.
patients
Or
are actually
Barrett's.
found to have
Right.
colon cancer when they're getting
Or
screened.
Barrett's,
Or the
we're
patient
following
with
all those
Barrett's
people
when they're
too.
being surveyed. Pancreatic cancer is much more, this is only chance for making an impact in pancreatic cancer is when you pick it up early. We have I've recently published a couple of papers which basically showed that the tumor is less than 25 millimeters in size and has one or less lymph node. That is the only time
That's your
surgery
chance.
makes an impact, and a huge impact at that. So I would think I would aggressively push for screening or surveillance on the patient with pancreatic cyst, even more so than colon cancer or Barrett's esophagus.
Interesting. Even more so.
Yeah.
Interesting. Any last take-home points you'd want to share with the readers?
Well, I think I think the data that we have presented, as interesting as it is, I think definitely needs validation. So more studies need to come up. We are ourselves planning on follow-up studies to validate to make sure that the data that we have
Right.
is not artifactual, has huge implications. But again, like anything else in medicine or science, we need to make sure that the data is real.
And you guys did it to 2007, so you have a potential window to go from 2007 to now. To
Oh
look
yeah, the
again.
thing is, this is what we did was a VA
Probably more
database, and
imaging
we
now.
got a sample of the VA database. So we are now actually getting a IRB to get the entire database. So we several million people in the database, and the database exists much longer. So I think we will be able to have a much higher quality data in our next publication.
And we'll look forward to it.
Thank you.
Thank you very much.